Hi guys, so like I promised you, I am going to read these NewsELA articles. You have two different ones. You have shut down by coronavirus, schools scramble to feed students, and then you also have an opinion piece about fear about the coronavirus is normal, but don't let it control you. So I'm going to read this first one. This is in the health category. We have where this was published just not too long ago, okay, and it's recommended. Okay. So the coronavirus is causing more and more schools to close, as you guys know. So there's a personal connection. You could write that right next to it about like, hey, my school closed. It is forcing school leaders across the country to address another problem. If schools shut down, their students may not be able to get the meals they need. A coronavirus is a type of virus that typically causes colds. This latest coronavirus causes flu-like symptoms. It can be deadly. Millions of students rely on the free or discounted meals they eat at school. Some people worry that as more schools close their doors, more children will go hungry. Joel Berg is the leader of Hunger Free America, a New York-based nonprofit. He said that these school meals are a big deal. Almost 30 million kids a day rely on them, he said. As of March 9th, 507 schools throughout the United States have been closed or are scheduled to close. These school closings affect 363,357 students. You could write next to that, like, that is a big number. I mean, and that's just out of those schools. So think about now where we're at, because now schools across the U.S. are closed, like as a whole, I believe. Health officials are saying social distancing can help limit the spread of the disease. Social distancing is when you stay away from crowds and crowded spaces to prevent the spread of a disease. This is why schools are shutting down. This is also why people are being told to stay at home. The U.S. Department of Agriculture oversees the nation's school meal programs. It has instructed schools on how to feed students during these closures. That does not mean it will be easy for schools to make sure that students get the meals they need. I mean, even think about our district. Our district has made all sorts of moves in making sure that, if you guys need food, food's getting to you guys. Okay, but it's taken a lot of planning in a very short amount of time for them to figure that out. Access to food. In Fremont, Nebraska, the district decided to shut down schools for the week. A person in the community may have gotten the coronavirus. That means roughly 4,300 students are out of school for at least 5 days. About 6 in 10 families in the school district may receive free or reduced lunch. The school district does not have plans to distribute meals to students. The schools are working with local food pantries, though. They are making sure children do not miss meals. The Agriculture Department allows some districts to offer meals using programs created to feed low-income children during the summer. The program says children must be fed in groups, though. Because of the coronavirus, people should not be meeting in large groups. It could make more people sick. The School Nutrition Association is a group that works to put good meals in schools. It wrote a letter to the Agriculture Department asking to make some changes. It asked for meals to be given to smaller groups of children. It said meals should be served at closed schools and community sites. The group also urged the Agriculture Department to allow districts to deliver meals to more locations. It would be safer and easier for families to get their meals this way. So that's something our district, I know, is doing, is they are delivering food out to people. So there's a connection that we can make sure, again, if you're writing all over this and annotating and you want to focus on like connections between what we're experiencing as a district and what the nation is doing, there's a really good thing you could draw out right there. The Centers for Disease Control and Prevention, or the CDC, is a government group. It works to keep people in the U.S. healthy. The CDC gave advice in response to the coronavirus. It suggested that schools consider ways to distribute food, such as offering grab-and-go bagged lunches or meal delivery. That way, students will not have to gather in groups. California and Washington State asked the government if meal services can continue while schools are closed. In early March, the Agriculture Department said yes. A basic need. Coronavirus has caused the most problems for schools in Washington State. Schools there said they have struggled. It is hard to keep meals flowing to students. In Bothell, Washington, the North Shore School District closed all of its schools on March 5th. They may be closed up to 14 days. The district began online classes on March 9th. It provided lunches to students too, offering grab-and-go meals at 17 school sites. Juliana Fisher is in charge of the district's food services. She said that students cannot learn if they do not have the nutrition they need. The district has 23,500 students. More than 3,000 of them may receive free or reduced lunch, Fisher said. The school had to make plans to deliver meals safely. She said school workers organized into groups and made a plan to deliver meals. Students did not have to pre-order their lunches. If they showed up, they received a meal, Fisher said. Situations like this really show how important school lunches are for some families, she added. So that is our article. And again, if we go on, you guys also have the quiz, just meaning you guys have some questions to answer. I'll read those questions out for you. Question 1, read the paragraph from the introduction, paragraphs 1 through 7. Millions of students rely on the free or discounted meals they eat at school. Some people worry that as more schools close their doors, more children will go hungry. Which of the following is an accurate explanation of what this paragraph means? A, millions of students have already received free or discounted meals since schools shut down. B, millions of students want the schools to open up so they can get their free meals. C, closing schools down can lead to problems for many kids who depend on school meals. D, closing schools down is the safest thing to do until the coronavirus passes. So again, choose the answer that best connects to millions of students rely on the free or discounted meals they eat at school. Some people worry that as more schools close their doors, more children will go hungry. Read the section, Access to Food. Which sentence from the section shows why the School Nutrition Association wrote to the Agriculture Department? A, the Agriculture Department allows some districts to offer meals using programs created to feed low-income children during the summer. B, the program says children must be fed in groups, though. C, the School Nutrition Association is a group that works to put good meals in schools. D, it asks for meals to be given to smaller groups of children. So which sentence from the section shows why the School Nutrition Association wrote to the Agriculture Department? Question 3. What caused the district in Fremont, Nebraska to shut down schools? A, the district did not have enough school meals. B, the Agriculture Department asked them to do it. C, the CDC ordered all schools in the U.S. to close. D, someone in the area could have gotten the coronavirus. So what caused the district in Fremont, Nebraska to shut down schools? And last question, number 4. What effect does social distancing have on the spread of the disease? A, it can make it more likely that a disease will spread. B, it can lower the chance of the disease spreading. C, it does not have an effect on the spread of the disease. D, it can cause the spread of the disease to get worse. So what effect does social distancing have on the spread of disease? Right. Feel free to pause me, but I am going on to the opinion piece. So this is the second article you have. It is opinion-based, so fear about the coronavirus is normal, but don't let it control you. And again, this one was written fairly recently. Coronavirus is a large family of viruses. It includes the common cold. A new coronavirus has recently emerged. It first appeared in China. The name of the virus is SARS-CoV-2, and the disease it causes is called COVID-19. It is also called coronavirus. The virus is spreading across the globe. More than 100,000 people have been infected with the virus. Over 3,000 have died. The coronavirus outbreak has become one of the biggest events of this century. Health experts warn that the disease will probably keep spreading to more and more areas. This is pretty scary, and the fact that it's scary is causing new problems. And again, as we read, you can connect this to what you guys already know. Fearing things we don't understand. The problem with scary things is that humans are not very good at reacting to them. We are terrible at understanding risk. Here's an example. People are much more likely to die in a car crash than a plane crash. Still, for most of us, a shaking airplane seems much more scary than almost getting into a traffic accident. This is not very practical, but there is a reason for it. We fear things that we don't understand. When we feel afraid, we try to control what we fear. Sometimes we do things that don't make much sense, just to feel like we are in control. In the case of the coronavirus, there are some big examples of this. For example, panicked people have been buying extra household items. They are stocking up on toilet paper and ibuprofen, which is like Advil. Many are doing this even though they live in places where there is no outbreak yet. Local stores are not at risk of running out of those items. People are also buying lots of face masks. Evidence strongly suggests that masks are a waste of time for most people. So not like face masks, like a small mask, like the thing that covers your nose and mouth that you often see whenever you're in hospitals. For weeks, health experts have said that the main reason to buy a mask is if you are sick. In that case, the mask can help. It stops you from spreading the virus when you cough or sneeze. Still, people are buying up masks even though they are not sick. Some people have also started selling and buying products to cure the coronavirus. These include pills and teas. There is not any evidence these products work. They're probably a waste of money. That brings us to one of the scariest parts of the coronavirus. Most of the recommendations from health experts are things that other people have to do. They should wear a mask if they are sick and cover their nose and mouth when they cough or sneeze. They should stay home if they feel sick and see a doctor as soon as they have symptoms. If people who are sick take these steps, it can help slow the spread of the virus. Stop, Rose. Everyone needs to make informed choices. Relying on other people can be scary. It means not having much control over your own fate. Nobody likes this. Yes, you can and should make an effort to wash your hands more and stop touching your face. However, doing these things doesn't make us feel safer. We need everyone to be making informed choices too. I think that is what the panic is really about. People are trying to deal with their fear by taking action. These actions give them a feeling of control. We all want to do something to keep ourselves from getting sick, even if it's probably not going to work. Buying 15 tubs of hand sanitizer makes us feel protected. It's kind of like a trick we play on ourselves. We feel a little better, even if we just as well buy... Stop! Even if we'd be just as well off buying a normal bar of soap. Stories about the coronavirus are scary. We may not have control over everything. Still, remember that there are proven things you can do to help yourself. The World Health Organization studies public health across the globe. This group has published simple tips on its website. Anyone can follow these tips. One is to wash your hands more often. Another is to practice not touching your face. Stop! This advice probably seems boring, but often boring advice is the best advice. In the end, the most important thing is not to panic. People often panic when they hear the word pandemic. A pandemic is when a disease spread worldwide. Many people think a pandemic only involves serious, deadly diseases. The next time you hear this word, take a deep breath. Remember that pandemic describes how a disease spreads, not how serious it is. Fear is okay. Fear is okay. It is normal to feel afraid. Even experts have said there are many things about the coronavirus outbreak that we don't know yet. That is scary for everyone. Still, try not to let the fear control you. You may have to live with that fear for a while. So the scientist who wrote this is a scientist who studies diseases. The opinions belong to that article, the author, and they don't necessarily represent the views of everybody else. But again, we have where this is just stressing its opinion piece about how fear is normal, but you can't let it control you. Please stop buying all the toilet paper. Now, we have where the quiz questions. I'll do the same thing. I'll read them, and then you guys will answer. So what happened, number one, what happened as a result of the coronavirus? A, people bought unnecessary things to try to feel safe. B, people started traveling to areas that were not affected. C, people invented products that could cure the disease. D, people gave masks to other people to stop the disease. So which one happened as a result of the coronavirus? Question 2. How do people stay safe from the coronavirus? A, they buy a lot of hand sanitizer from the store. B, they take pills and teas to cure the disease. C, they should avoid touching their faces. D, they wear masks before they get sick. So how do people stay safe from the coronavirus? Question 3. According to the article, people fear what they do not understand. How does the author support this claim? A, by explaining why people should buy more toilet paper. B, by comparing people's thoughts about planes and cars. C, by stressing that the coronavirus is like the common cold. D, by describing how the coronavirus spreads quickly. So how does the author support the claim that people fear what they do not understand? Question 4. What is a reason the author gives to support the idea that people should wash their hands to protect from the coronavirus? A, it gives people a feeling of control over the virus. B, it's a way that people can cure themselves. C, it helps people to understand the risk of the virus. D, it is advice given by the World Health Organization. So what is a reason the author gives to support the idea that people should wash their hands to protect them from the coronavirus? Right. So, in the previous video, if you guys look, I know it's 46 minutes. I know that's super duper long. That one is just kind of reviewing. I mean, it talked a little bit about 1 through 3, but not like in great detail. It talks a little bit about number 4, the commonly confused words. Again, really it focuses on numbers 5 and 6, just focusing on different types of sentences and the importance of punctuation. This one focuses on number 7, which was the NewsELA articles. So again, if you need to rewind and listen to the reading of the article again or the questions, that's totally 100% okay. Again, feel free to reach out to us. You can contact us on this classroom. You guys could catch us in the study skills classroom, or you can catch, like I have this chat open. I'm going to have it open from 10 to 2 every day. My email, you can see I've got emails now. So you guys, there are multiple different ways that you can get a hold of us, okay? And if we don't hear from you, we are going to find you, and we are going to talk with you, all right? Because we want to make sure that you guys are okay and that you guys know that we're here. So those are just, here's 2 screencastifys, one about the punctuation, and then this one about the NewsELA articles. Just keep an eye out for the ones that Mr. Dempsey and I post. We're going to try to do this with each NTI assignment that we give you guys, so that way you are constantly in the loop of what we're doing. Okay? So remember, stay safe. Follow what the World Health Organization, the CDC, tell you to do, like wash your hands, don't touch your face. Rose, stop. My doggy's very sad about the coronavirus. If you guys haven't noticed, she's crying, even though doggies aren't supposed to get it. She is tired of me, so she wants me to be with you guys, because obviously I miss you guys. All right, so stay safe. Make sure you're washing your hands. Don't touch your face. Practice social distancing. Remember, that doesn't mean that you don't have to talk, like that you're not talking to people for days and days. It just means that you are giving people their space and staying home. If you need anything, please do not hesitate to reach out to Mr. Dempsey or myself. All right, guys? Have a super good day. See you soon.